Hello, moms of little miracles. Let's have this big conversation. We're continuing with our history taking. But before we go on, I want you to follow us on Konak Media TV on all social media platforms. Konak is Konak. Thank you. I'm here as usual with Sister Sylvia Asoji, and I'm yours truly, Ivy Cobson. We ended with previous history taking or obstetric history taking, and we would continue with problems during pregnancy. Why do you want to know if I encountered any problem during my journey? Sister Sylvia.
Hello,
Of what
viewers.
use will it be?
It's of great use. Because as previously we discussed, we said we dwell on previous history to take care of the mother and then the baby. So if, let's say, you encountered some problems, it could be maybe you had some issues, chronic complications. Let's say you had diabetes or hypertension as a result of the pregnancy. All those ones will be recorded here. And then as the pregnancy is advancing, we will be checking, monitoring you in that aspect.
Okay.
To see if you would go back, fall, or we will have to devise different means of seeing to you. With that, it broadens us to be able to know, oh, maybe Auntie Equia is already on hypertension medications, diabetic medications. How is the baby faring? How is the woman faring? And if it's supposed to be continued, changed, and other things, we can be able to do that for the woman.
Okay. Okay. And what of you asked of how the labor progressed? Why do you want to know how my labor ended? Whether it was smooth, it had no problems. Of what importance? Do you want to get your things ready so that if labor is not progressing, you rush me to theater or what? Or you want to transfuse me?
No.
Is it also necessary?
It's necessary in that aspect. But you getting whatever happened during the labor also it reinforces you to gather your things. Maybe the woman came, she was okay. Labor was progressing, everything was fine. But as the labor was going, you realize that things were changing, which needed that the person sent to the theater, or maybe you need to devise other means of receiving the baby.
Okay.
Labor can start normally and end up abnormally. It depends.
Okay.
So it reinforces you to be ready for anything at all that is coming to you.
So, mothers, when you are asked of how your pregnancies and your delivery process went, please, it's because we want to safeguard you and we want to be prepared for any eventualities. So from there, Sister Sylvia, we head straight to this side, which talks about the infant feeding, medical and surgical history, or your social history, or any family history. We normally feel, we as mothers normally feel you are prying too much. Is that the reason?
Oh,
Are you prying too much?
We need to pry.
Don't you think you people are invading our privacy, asking about our family histories, whether my family has hypertension, of what use has it got to do with this pregnancy of mine?
It's of greater use because
And whether I breastfed my child with exclusively or not, of what use?
successfully, they are all of greater use to us. The infant feeding can be that maybe the previous births you had issues concerning your breast or any other thing that prevented you from breastfeeding. If it is something that we can curtail, it is something that we can work on, we will work on so that this baby can be able to suckle or be able to breastfeed successfully.
Okay.
If it is something that is connected to maybe how your breasts are, you
Your
have to
nipple.
start from the antenatal, because some have nipples
Inverted.
that have gone inside, which needs to be worked on. During ANC, you'll be
Okay.
using the shea butter or any of this to massage it so
Okay.
that it comes out. If it is so flat that the person cannot breastfeed to, there are
No
means
means of
that
okay.
we. So when we get this information, we can be able to advise you on what to do. And then about the previous, let's say, medical conditions that runs through the family. That means if you have any of such, we feel that it is transferred. They are like genetics, that if mommy and daddy may be having a hypertension or diabetes, you
The
can also have it.
possibility of
And
you
then,
having it.
yeah, and babies that are carried by those mothers, we say they are special in some way. They need special attention and special needs of how to maybe monitor them during pregnancy, or even if they have to come out. The diabetes mothers mostly have big babies, and you know hypertension and also pregnancy has a way of
Yeah. Weighing on the
weighing
mother.
on the mother. Sometimes some people don't even go through normal term pregnancy.
Okay.
They have their babies extracted before the normal timing because the BPs may be going up.
Yeah.
And then so when we get to know all this, we'll be able to take care of the mother. Maybe some are already on some medications
Yeah.
connecting to those conditions that I have mentioned, that maybe as pregnancy advances, it may be towing on them. Either they will be changed, they will be mixed, so that the pregnancy can contain the medications that they are taking, or any other way that you can help the baby as well as the mother. Yeah.
That's also good. Please, to add to it, if you've also had any any operation, it could be cesarean section, it could be laparotomy, or any kind of surgery, please don't hide it. Just voice it out. Also, when we ask of any mental illness, we just want to know what would happen after delivery, because we have something called postpartum blues, which ends up in depression.
Yeah.
So if you have undergone any mental illness, don't shield it, so that the nurses would refer you to a counselor or a psychologist to help you through your journey, so that we have our little miracles staying in a happy home after the delivery process.
Yeah.